And we know that formal and informal conversion practices are still being conducted in South Australia today. But informal practices are those being done in places where people are most vulnerable and where people are least likely to complain, like a psychologist or in GP offices. In places where we are supposed to be able to trust professionals to leave their personal religious beliefs aside and provide effective clinical care to their patient. Sam said to me, "In my teenage years, I had body dysmorphia. I said to my mum, I don't think I'm in the right body, and she just said, you are not right. I think we need to get prayer for you. There's a spiritual curse over you, a demonic presence." She took me to a GP and I said I was really unhappy. The doctor knew my mum, and that's where you go to the same GP, the family GP. They knew my family, and I thought that was just normal. He was a Christian as well, and he used to give me scriptures. He just said to me, I need to pray more. Sam went on to tell me about their experience engaging a psychologist as a way of treating depression and anxiety from years of emotional and spiritual abuse. It was 6 sessions in when she decided to tell me she was a Mormon, that my God is not the right God and I should consider their religion, and I was just so disempowered. It scares me to this day that that person is still practicing. So there are professionals engaging in conversion practices behind closed doors, peddling their religious views about gender and sexuality in moments of vulnerability in their patients' lives, and when they're expected to provide professional and impartial healthcare services. Predatory conversion practices must end in our state, and we must hold to account these rogue operators who breach their professional codes of practice to manipulate queer people seemingly with immunity. This is not an issue for the too hard basket. This is an issue of holding practitioners to account to keep their religion out of healthcare and put the health outcomes of vulnerable young queer people first.